I'm Dr. Sarah Ansari from Pediatric Healthcare Alliance in Tampa, Florida. We get many questions about vaccines from our patients' families. We put together this video to see if we can answer some of those questions. Our pediatricians believe vaccines are an important health-promoting intervention, and we hope this information is helpful to you as you make healthcare decisions for your child. One question that we commonly get is, why do we vaccinate against certain diseases even if we don't see them anymore? It's true that some diseases like diphtheria and polio have not been prevalent in the U.S. for many decades, but that is largely due to the fact that we are all vaccinated against those diseases. However, these diseases are still prevalent in other parts of the world. If too many people are not vaccinated and become unprotected, it makes it easier for us to contract that disease in this country, and then those diseases will become more prevalent. We cannot stop vaccinating until these diseases are completely eradicated. Otherwise, those few cases that are present elsewhere will become an epidemic again. An example of a vaccine we no longer use is smallpox, and that's largely because we've been successfully immunized and it has been eradicated. Another common question is, why are there so many vaccines now as compared to previous generations? Researchers are always studying diseases and ways to prevent them. We're fortunate to have many vaccines that prevent deadly diseases and diseases that can cause severe illnesses, compared to only a few vaccines that were available during previous generations. It is also important to know that vaccine doses are scheduled for the age when the body's immune system will work the best, and the recommended vaccine schedule is balanced with the need to provide protection to infants and children at the earliest possible age. There is a concept of herd immunity in relation to vaccinations. What is herd immunity? Herd immunity is achieved in a community when the majority of people in that community are immune to a particular disease. These people are immune to it either because they have been vaccinated against that disease or because they have had it in the past. This makes the spread of that disease in that particular community much less likely because most people are immune to it. Why is herd immunity important? Herd immunity makes the spread of a disease more difficult and may hopefully eliminate the disease entirely. We seldom see certain diseases, such as the measles, but with the ease of international transportation, these diseases are just a plane ride away. If an infected traveler does bring a rare disease to the United States, and most of us are immunized, the chance of spreading that disease becomes smaller. Herd immunity is also important for common diseases because there are certain groups of people that cannot be immunized at all. Who cannot receive certain vaccines? Children with allergies to certain components of vaccines, such as eggs, cannot receive certain vaccines. Newborn babies are also susceptible to vaccine-preventable diseases until they reach the recommended age for many vaccines. Children with weakened or compromised immune systems also cannot receive certain vaccines. Another common question is, if one family chooses not to vaccinate their children, how does that affect the other families? It really affects those kids who cannot receive vaccines because of weakened immune systems or because they may have allergies to certain vaccine components. Newborn babies are also not eligible to receive many vaccines due to their age. Herd immunity can help protect these children when there is a high immunization rate by those who are eligible for vaccines around those kids. Further, if enough people are not vaccinated, then diseases that are now rare can become prevalent again. Also, immunity can fade over time, so even when children who received immunizations, they can become susceptible to certain diseases that are carried by unvaccinated children. Why do we vaccinate against common illnesses like chickenpox and the flu? Although common, these diseases can cause death and serious complications. Vaccines can help prevent these complications. We hope this information is helpful to you. If you have any questions about vaccines or any aspect of your child's health, please contact your child's pediatrician. I'm Dr. Sarah Ansari with Pediatric Healthcare Alliance in Tampa. Thank you for watching.